4 students have come to ask me about wrist rehabilitation. Why haven't I talked to you about rehabilitation until now? If you can't learn what I've taught earlier, any other wrist rehabilitation you do will only relieve the symptoms. And as for your hands, I've done a lot of rehab for wrist pain and issues like medial or lateral epicondylitis. I specifically take on cases where patients visited top-tier institutions like Peking University Third Hospital or Sanliao Hospital, some of China's most renowned facilities, but haven't seen the rehabilitation results they expected or found their recovery to be satisfactory. The reason I'm able to deliver immediate results for them compared to their specialists all comes down to differences in the chain, differences in the kinetic chain. When it comes to relaxation techniques or acupuncture, they're much more skilled than I am. As for bone setting, they're also very good. Anyone who comes to see me is definitely someone who can afford the very best bone setting practitioners in China and can also afford the top acupuncture and needle knife specialists in the country. So why is it that their problems still can't be resolved? It's precisely because of his lack of strength that this area becomes unstable. Yet he chooses to play tennis and golf, and he's passionate about these sports. Or perhaps these sports are part of his job. As a result, the damage is always there, which is why his problem hasn't been resolved anywhere in China. Because his problem is caused by weakness. While he's engaging in these sports, this area continues to be damaged. So, all the renowned doctors he consults are the best at relaxation techniques and the best at realignment, but none of them specialize in stabilization. If you want to find someone who specializes in stabilizing this area, you need to know which exercises will actually stabilize it, and you need to know which finger controls this part. Only then can you train it to be stable. Once it's stable, it can withstand this kind of damage and improve athletic performance. So when it comes to wrist and elbow rehabilitation, it's a very meticulous task. How meticulous? Down to a specific segment of a single finger. That's why I can train them until there's no pain, and I can train them to the point where they can play a full round of golf without issues. Being able to play a full match, tennis relies on these fundamental training skills. Now let me tell you about their differences. Let's start with the simple one. The difference in pain between the inner and outer sides of the elbow joint. What about the inner side? The inner side involves most of the fingers. The muscles responsible for wrist and finger flexion are all located on the inner side. The flexor muscles are attached to the medial epicondyle on the inner side of the humerus, and most of them are flexor muscles. Then, on the radial side, most of the muscles are deeper. In other words, if your activity uses the flexor muscles more often, if your flexor muscles are weak, it will lead to instability on the inner side of your elbow joint. For example, when you lower the club in golf, aren't you flexing? Isn't the inner side bearing the force as you grip the club? And when you play golf, don't you have to grip the club? Don't you have to ulna deviate your wrist? That's the only way you can hold the club. And at the moment when you swing down and hit the ball, this area must be stabilized. If you don't have this ability, every time during the downswing, if this area is weak or unstable, especially for beginners, especially when you miss the ball and hit the ground, the reaction force acts directly here. This direct and rapid force can easily cause a misalignment in this area. This is precisely the reason why pain often occurs right here, a condition commonly known as golfer's elbow. For anyone struggling with golfer's elbow, it is essential that you work to stabilize this entire area and strengthen the flexor muscles of each and every one of your 5 fingers. Because most of the flexor muscles are attached here, it means that this person's fingers are weak. So, no matter how you try to realign this area, or how you do acupuncture here, or whatever massage you perform, it will only provide temporary relief. That's because you can never truly stabilize the inner side of the elbow joint. So, if someone often plays golf and develops golfer's elbow, and then comes to you at the gym for help, if he comes to buy personal training sessions to lift weights, you won't be able to help him build up his biceps because this area is unstable. At this point, your professional skills are really put to the test. If this area has already been pulled apart, you need to find a way to first adjust it back to the correct position. After adjusting it to the correct position, you need to train his flexor muscles. The most basic thing is to start by training his flexor digitorum superficialis, then the flexor digitorum profundus. Next, you also need to train the flexor carpi ulnaris. All of these need to be worked on. In addition, you have to train the function of the thenar muscles, the strength of the thenar muscles. You need to train not only the strength of wrist flexion, but also the strength of finger flexion and the strength of the thenar muscles. Only in this way can you stabilize this area. Once stability is achieved, when you go back to playing, you also need to correct his movements. Only then can you prevent him from getting injured. So at this point, what do you at least need to do? For example, the strength of finger flexion, at the very least you need to do pulling exercises at the end range. Pulling exercises are for training the flexor digitorum superficialis, right? And if this person has a golf-related injury, you shouldn't have him do high pulley lat pull downs because those involve a bent arm motion. You should have him do straight arm pull downs instead. At this point, you're training stability of the wrist, and when doing straight arm pull downs, what should you choose? Don't pick a straight bar, you should use a rope. Only the rope allows for ulnar deviation, which is exactly the straight arm plus ulnar deviation motion used in golf swings. This way, you can achieve stability. If you use a straight bar, during resistance, the wrist will be in a flexed position. This is not the movement used in golf, which is why I say, if you want to prevent sports injuries from recurring after rehabilitation, you need to understand the specific movements of the sport. In golf, after the backswing and during the downswing, the elbow joint remains extended with ulnar deviation and the spine assists the swing. So, when you train, you need to focus on the muscles involved in keeping the arm straight with ulnar deviation. Only by training this entire muscle chain, its biomechanical force transmission, and its ability to stabilize the joint, can you truly resolve the problem. So in the gym, when you look at all those machines for training the triceps, are they suitable? No, they're not, because this is for a golf athlete, especially if it's the left hand. If there's pain on the inside of the elbow joint and the left hand compared to the right is relatively kept in a straightened position, then for an injury to the left hand, you need to do this kind of training. If it's pain on the inside of the right elbow joint, the arm is bent when lifting and straight when lowering. So for the right hand, you can use the rope. So rehabilitation needs to be very precise and meticulous. It's not just about working out the elbow joint. It's not that all the muscles responsible for flexion and extension can help maintain the stability of the elbow joint. I need to look at the specific area of injury. I need to see exactly how he was injured, and I need to look at what kind of joint function he uses during this particular sport. Then I focus on the muscle chain responsible for the mechanical transmission of force in that joint function and help him restore that chain. As long as he can maintain stability and perform the movement during the activity, that's sufficient. For example, if this person plays tennis, tennis players are prone to pain on the lateral side, especially on the radial side. Why? Because tennis rackets are quite heavy, especially when the ball comes over, so they are constantly. There's a lot of wrist extension and flexion involved, especially when someone is hitting a backhand, particularly a one-handed backhand. At this point, if these three fingers can't grip tightly, if your brachioradialis, your supinator, or the lateral head of your triceps brachii are weak, then what happens is the lateral side of your elbow joint becomes unstable. So, for tennis players, when you train, at the very least, you need to work on what? Wrist extension with radial deviation combined with elbow extension strength. When it comes to elbow extension, you can't train it like this. Training it this way is useless. Doing it this way only works the medial side. In other words, when you do triceps exercises and press down like this, you're only training the muscles that stabilize the medial side of the elbow joint. So, in this case, you need to pronate your forearm, internally rotate your shoulder, and then supinate your forearm to train it properly. Only then are you working the lateral chain. After gripping with these three fingers, this is how you train the lateral chain, and only then can you stabilize the lateral side. This is what prepares you for playing tennis. That's why I say, if someone does an exercise, they can't even analyze sports movements. They don't know how injuries happen, they don't know which chain is weaker or which area needs to be trained. So, to break it down simply, for people who play golf, I need to train the grip strength of these three fingers. Do it. The ability of the ulnar side of these three fingers, and then for tennis elbow, I need to train the strength of these three fingers, the strength for extension, and the strength for radial deviation. I also need to train the lateral head of the triceps. Then, if it's the medial side of the elbow joint, I need to train the long head of the triceps. And the medial head, that's the difference between them. So what if this person has pain on the lateral side, for example? When he does a supination movement with a barbell, he's someone who likes strength training, he likes weightlifting, and enjoys playing cosplay. Then, whenever he does this kind of supination movement, it hurts here, because this movement requires explosive power. At this point, if his grip isn't strong enough, when he flips his wrist like this, the area that can't generate enough force will put more strain on the elbow joint. So you need to have him do a lot of reverse curls, with palms facing down, forearms in a pronated position. He needs to do more of these curls. What does this train? This specifically trains his brachioradialis, which has a rather unique function. The finger flexors need to grip tightly, and at the same time the extensors need to be strong. So it's the finger flexors, combined with the wrist extensors, together with the brachioradialis working as one. So what exactly is this? This is exactly the 3-nil force. So you need to train this strength well first, and only then when you flip can you lift heavier weights and avoid injury. So it's actually quite complicated. But basically, I can tell you any injuries that occur during exercise. In general, injuries to the fingers, wrists, elbow joints, and shoulder joints are usually adjusted from the distal end to the proximal end. In most cases, whether it's a golf injury from playing golf, tennis elbow, biceps long head tendonitis from bench pressing, or subacromial impingement from pressing dumbbells, Basically, the problem starts from the distal end, that is, from the area where you grip. This also applies to many people who do street dance or parkour. There are also people who often jump down from heights and use their hands to support themselves, including soldiers who fall forward and brace themselves with their hands. In these cases, they basically have a habit of putting pressure on the backside. This causes things to fall apart and leads to many problems. There's also a rather special category involving the wrist area. For example, if someone has tenosynovitis, or if they have median nerve damage, or if their wrist area is unstable and wobbly, then you shouldn't have them do wrist exercises because everything here is already loose. Wrist exercises won't help. If you want them to train their fingers, there really aren't many muscles here. There's only one relatively developed muscle called the pronator quadratus, which is a very small muscle. This area provides support, and below it are all tendons, so the stability of the wrist mostly relies on them. The tendons of the flexor and extensor muscles of the fingers pass through here. In other words, when both your flexor and extensor muscles are tightened at the same time, all these tendons become taut, and only then is your wrist stable. The wrist is very thin. Why is it thin? Because there are no muscles here. It's all cords, all strings. In other words, only after all these distal muscles tighten and pull these strings taut does your wrist become stable. So the stability of the wrist is entirely dependent on the fingers. Only when your fingers are clenched does your wrist become stable. Therefore, after you reset the wrist, even if you put it back in place, it can easily become dislocated again. Training the wrist itself is useless. Many people just use dumbbells to directly do wrist flexion, extension, radial, or ulnar deviation exercises, but these are ineffective. You've skipped the most important step. You need to first train this kind of strength. This kind of strength. Once you've trained it to be stable and can exert force, your wrist actually doesn't need separate training. It will naturally become stable. Then, after you finish training those, you can have them do these kinds of movements. Only after training can it work. So just now, there were two cases like this. Their entire wrists were almost completely damaged. When they rotate their wrists, it makes a cracking sound inside, and it still hurts. Then, when they grip like this, it hurts. And when they grip like that, it also hurts. Then there's no need to train anymore, no need to train the wrist, just train your fingers. For people like this, your biceps, triceps, shoulders, chest, and back won't grow much, because in all your upper body training, the force transmission line will break right here first. The force breaks off here first because your strength in this area is too weak. That's why when Shaolin monks first enter the temple, they spend their first years chopping wood and carrying water. Only after 3 years do the masters start teaching them techniques. Chopping wood is to train your grip with the hammer and axe, and carrying water trains the hooking strength of your fingers because the handles of the water buckets are all made of steel or iron. The handles are very thin, so when you carry water, you're basically hooking your fingers around them. The strength used to lift, and then when chopping wood trains the strength of your grip after clenching tightly. You have to use force like this, and when you lift, flipping upward trains the strength of your wrist. There are also exercises like the Gong Rao Ji for this kind of training. So basically, after chopping wood for 3 years and carrying water for 3 years, you've trained this whole set of skills thoroughly. At that point, whatever you practice, you'll improve quickly. So back then, the master wasn't just making you do hard labor for free. It was to help you build a solid foundation. Once you've mastered these basics, when you go on to learn martial arts, your strikes will have power and stability. Otherwise, if you hit someone, you might land the blow, but nothing happens to them. Meanwhile, you end up spraining your own wrist. That's because you're not stable. You can't grip tightly. So that's why this kind of thing happens. Alright, so this is about the rehabilitation of the fingers, wrists, and elbow joints. Whether you have tenosynovitis, what is tenosynovitis? It's when your thumb's ability to grip is weakened. If you can't grip tightly anymore, then your concentric and eccentric strength is lacking. So in this situation, what do? We take a rope, hang it like this, and then hook it with your hand like this while walking, or hook it onto a barbell plate, hooking it right here. Since the thumb only has 2 segments, you just need to hook it on the distal segment like this and walk while hooking it. So for anyone with tenosynovitis, after they bend their thumb down, the thenar eminence is soft. For many people, as soon as they bend it down, they get a cramp, right? Exactly, that just means when you usually train, your thumb isn't gripping tightly at all. So for people like this, if you use your phone a lot, you're more likely to get tenosynovitis. Now, what exactly is mommy thumb? It's when you grip your thumb and pull it down like this, and it hurts a lot here. This means that when you're chopping vegetables, your radial deviations, concentric strength, and eccentric control are both relatively weak because housewives are always chopping like this. Rapidly chopping potatoes over and over, so this area is constantly moving. As a result, it gets overstretched and the movement frequency is too high, which leads to injury here. That's why it's called mommy thumb. And then So you just can't do this kind of movement. That's why for people with mommy thumb, it's impossible to build up the brachioradialis, and you can't develop the separation between the brachioradialis and the long head of the biceps, because there's a disconnect here. So for people like this, you need to first train the strength of your thumb grip and then work on your radial deviation strength. Only then can you completely resolve the problem of mommy thumb. These are the so-called more difficult problems you encounter. All of these issues are very typical cases of lacking targeted training. So when we look at tenosynovitis, mommy thumb, golfer's elbow, tennis elbow, and from the perspective of the hospital, the way we view them is different. Of course, I know that there's inflammation here. I not only know that there's inflammation here, I also know why there's inflammation, but you don't. And our advantage compared to the hospital is that hospitals are better at reducing inflammation. We are better at addressing the root causes that lead to the inflammation. Now, even if the doctor knows the cause, even if he knows the reason, he still can't solve it because he doesn't really know how to fix it. Because he does not truly understand the specifics of what controls this area. He doesn't really have the necessary capacity to rapidly implement and maintain stability here, so it necessitates that we step in to handle the situation ourselves. But in most cases, our coaches do not fully grasp the complexities of this either. If you don't really understand pathology, then you don't really understand why inflammation occurs here, right? You don't really understand, so what do you do after inflammation occurs? So there is a gap between the two disciplines, but let me tell you, whether it's golf, tennis, or conditions like mommy thumb, tenosynovitis, or carpal tunnel syndrome, all of these require both reducing inflammation and stabilizing the area. Both are indispensable. If, as a coach, all you know is training, but the person is already inflamed, the more you stimulate it, the worse the inflammation gets. And if you're a doctor, after you've reduced the inflammation and the pain is gone, as soon as the person returns to the court, they're injured again. So it requires a combination of both approaches. But to combine the two, I need to understand both pathology and training. Only then can I do it well. And nowadays, the people in this situation, anyone who gets injured playing tennis or golf, are basically the elite of society. They have the time, the power, and the money which allows them to spend so much time on these sports. The fact that they've already sustained injuries means they've played a lot. These are high-quality clients, but they don't really have any effective solutions available to them. Most of them either go to someone who's very good at reducing inflammation or to someone who's supposedly very skilled at training. Those who are good at training usually just focus on the larger muscle groups and don't really understand the underlying theory. And what I just explained to you, you can understand both times. Okay, so this is about the hand. If you can master this key point at this moment, no matter whether it's from the fingers to the shoulder, including the snapping of the scapula, including subacromial impingement, you can thoroughly improve all of these issues by practicing these basic skills. This is the rehabilitation between them. Now, if your goal is muscle gain, fat loss, and body sculpting, and you want to help your female clients tighten up their soft flesh quickly, even though they don't need to build large muscles, you still need to clear these pathways. Once you do, even in just one session, they might immediately feel the difference as muscle activation starts to tighten things up. If you're training for competition and want to build bigger muscles, then it's even more important for you to apply force precisely and have a strong ability to break down muscle fibers. So whether it's muscle gain, fat loss, body sculpting, or rehabilitation, none of these can do without these principles.